Our next presenter is Kathy Morgan. Kathy is currently the urban outreach nurse within the Centertown Community Health Center, assisting homelessness and those at risk of homelessness. She is a registered nurse with 30 years of experience, including working with the United Nations, and also she participates in the board of directors for Pauktuutit Inuit. Today she will talk about her work. Kathy Morgan.
Good afternoon, and I want to thank you very much. I'm very honored to be here today, and I want to recognize that we're on Algonquin territory, Goanimi. So I've been a nurse for 30 years. I want to say that this particular job that I have right now is probably the most rewarding that I've had. I work as a urban outreach nurse. It was originally called a homeless outreach nurse, but I didn't really like that term, so we've changed it to urban outreach nurse, and I work at Centertown. One fact about community health centers, there are over 800 in Canada. There's one in every province, and they offer a range of comprehensive primary care and health promotion programs. CHCs are structured and designed to eliminate system-wide barriers to access and harmful forms of social exclusion that can lead to increased burden or risk of illness. They aim to improve the barriers related to social determinants of health. So in my job as an outreach nurse, as soon as I walk outside my door, I feel like I'm on duty. I live downtown. I've lived downtown all my life. And so I'm often running into clients on the streets down in downtown Ottawa. And so my role there is to engage with them, for them to feel safe and comfortable with me. And then I try and refer them to our clinic. I also go to Cornerstone Women's Shelter, which is a shelter in downtown Ottawa. I visit there every Monday, and I partner up with Inner City Health Project. There's a nurse practitioner that goes there on Wednesdays. I go on Monday. There's 60 women in this shelter. They have an overflow of cots. It's run by the Anglican Diocese of Canada. I commend all the staff that work there. I don't know how they do it. It's a very chaotic place, but it's a safe place for all these women. And they're from all walks of life, from mental health, from refugee claimants, there's addicts, lots of problems. The other part of my job is visiting drop-in centers. So I visit The Well, which is a women's drop-in center on Elgin Street. It's for women and children, and Rachel is here. She's the executive director. And I visit the 507, which is another drop-in center on Bank Street. And again, it's to engage with the women or men and try and connect them to health services. So another thing we do is we go to rooming houses, and I'm not sure if you're familiar what a rooming house is, but they do exist in Ottawa. There's tons of them. They're not regulated. Basically, it's a room about the size of this table, and people have been living there for years, and there's a shared bathroom, shared shower. You know, they have to carry their toilet paper with them every time they have to go to the bathroom. It's really a horrendous place. So myself and another nurse practitioner from Somerset West go to these rooming houses once a month and try and engage with the clients there. There's seniors living in these horrid conditions. There's, it's just not very, bed bugs, cockroaches. So one big thing about my job is we have a clinic at Centertown, and my goal when I engage with these clients is to try and bring them back to our clinic that we have at Centertown, which is an urban outreach clinic. And it's a service that provides accessible, responsive health services to communities that are marginalized from mainstream healthcare services. Our urban outreach staff consists of registered nurses, a nurse practitioner, family physicians, psychiatrists, social and support workers, including harm reduction, personal support, community workers, and admin personnel. Our urban outreach program provides numerous flexible services encompassing health, wellness, harm reduction, disease prevention, outreach, case management, primary, mental, and prenatal care. So the types of clients we receive are homeless, they're vulnerably housed, living in poverty. And another thing I'm not sure if you're familiar with is Ontario Works and ODSP, which is the social service supports that clients receive. So if you're on Ontario Works here, your pay is probably $500, and that's supposed to include rent and food. So it's almost impossible to really make ends meet. And again, with on disability, if you're on disability, it's about $1,000, and that again includes everything. So we also see untreated mental health cases, sex trade workers, people who use drugs, and people who have no OHIP card. We also, provide an entry point for HCV testing, monitoring and treatment, and we've just partnered with the Ottawa General Hospital Viral Hepatitis Program, and so we're seeing clients in our clinic, and they're getting their blood work done for HCV. They're being referred for fibroscans, which is that scan Dr. Bolan was referring to, and hopefully go on to treatment. We've yet had anybody on treatment. So we provide a non-judgmental environment, which is very important with these clients. We provide primary care services, short-term counseling, mental health assessment, personal support, which includes ID. Most of these clients don't have any OHIP card, birth certificate, their N numbers are lost. So we have a worker that can help them with that, because really without any ID they can't go anywhere. We also have a worker that will accompany people to appointments, because that's also a barrier to healthcare. We have a shower facility, so Monday to Friday, excluding Thursday, people can come and access showers. So for example, on my way here, I ran into a fellow. He looked like he might have been a street person, because he had a big shopping cart with a suitcase and a whole bunch of things, and sure enough, he just arrived off the bus from Cornwall and didn't know where to have a shower and didn't know where to go, so I gave him our card and told him where to go. We provide harm reduction, addiction support, and ODSP referral. We work outside the box. After working in a hospital setting for many years, I've been very fortunate. I can work outside the box. I've had to use social media to find family members sometimes when there's been a death, and we've dealt with a lot of death with clients that have no family. We offer at Centertown a harm reduction service, which is an office that clients can come and receive safe inhalation and safe injection supplies. So the safe inhalation is your crack pipe, and the injection supplies are pretty well straightforward. And harm reduction, it aims to prevent overdose. It increases contact with health providers, and it reduces the spread of infection, reduces stigma and negativity. It addresses the human rights issues for drug users and other marginalized communities. The guiding principles: it does not necessarily require a reduction in consumption. The agenda belongs to the participant. People who use substances are considered an important part of all communities. Harm reduction strategies are evidence-based, and it recognizes that substance use needs to have diverse intervention approaches. And our center is in support of the safe injection site, which you've probably been hearing in the news. Hepatitis C rates in Ottawa are the highest in the province. 75% of hepatitis C are IV drug users. So I think there is still room for improvement. There's lots of work to be done, and I want to thank you for your time.